Hi guys, it's Brooke here. I have a super quick favor to ask. When you have a moment, please take just a second to give this podcast a 5-star review. This will help me to continue the podcast and continue to bring these resources to the community. Thank you so much for that 5-star review.
Some kiddos also respond very positively to certain sensory inputs. So I have a swing in my office, and there are some kiddos that are mute, 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 mute. They get in the swing and spontaneously are like, woo! Now that's not language, but it's a sound. So it is a bridge to help make that verbal communication easier. So often vestibular input, that movement input in the body can be helpful in supporting that regulation and that green zone and allowing language to then unfold.
Hey there, it's Brooke, and welcome to Finding Hope on the Spectrum, where I have heart-to-heart conversations with parents, professionals, and autistic individuals sharing personal insight and life experiences. Together, we dive deep into supports, programs, and stories that offer inspiration, insight, and most importantly, hope for the neurodiverse community. Before we begin with today's topic, please take a moment to like, share, and subscribe to this podcast. And if you know someone who this would be helpful for, please pass it along. Remember to always stay curious, be kind, and have an open heart. All right, well, we are going to get started today. We have a guest that was on previously, Jessica Richards, and previously we talked about PDA, and today we have the opportunity to talk about selective mutism. And this is an area that I have not as much experience with. So I'm so excited to have this conversation and learn from Jessica, and just really enjoyed our chat before we recorded this episode, and what a wealth of knowledge and information she has to share. And so I'm going to go ahead and introduce her. If you haven't listened to her previous episode on PDA, I highly recommend it. It was fantastic, and I'm excited to dive deep into selective mutism today. So Jessica Richards has over 15 years of clinical experience, advanced knowledge using the neuro-relational framework, as well as child-parent psychotherapy training. Jessica has deep expertise in both top-down thinking and feeling and bottom-up sensory motor work with families and individuals. Jessica holds a unique dual master's in clinical social work and child development. She is endorsed in California as an infant, family, and early childhood mental health specialist and reflective practice facilitator. 2. Her diverse experiences range from inpatient child and adolescent psychiatry to community mental health in South Central Los Angeles. Jessica was the lead therapist for the Child Welfare Court Team Pilot Program, fostering family partnerships in Los Angeles. As a therapist, Jessica specializes in working with complex profiles. She has deep knowledge and experience in trauma, sensory differences, autism, pathological demand avoidance, selective mutism, and anxiety. And with over 200 speaking engagements locally and internationally, she has enlightened countless child welfare, legal, mental health, and education professionals. She has been a keynote speaker at several conferences across the country and presented at 0 to 3 in the World Association for Infant Mental Health. So welcome, Jessica.
Thank you. Thanks for having me back. I'm excited to talk about this topic, which, as you mentioned, isn't terribly well known. So I look forward to sharing.
Fantastic. Well, let's just dive right into it. And I want to start us off by kind of going over a clear picture of what selective mutism is and how it typically presents in children.
Great. So it used to be called elective mutism. So if you've heard that phrase before, we're talking about the same thing. However, the diagnostic label has changed to reflect the fact that it isn't elective, which gives the impression that it is voluntary or intentional. And what we're talking about is a anxiety-based disorder that inhibits an individual's ability to speak verbally in certain contexts and certain settings. So these are individuals who otherwise have the capacity to speak. It is not a language disorder of production or ability to speak, but rather a mental health disorder that is associated with the inability to speak in certain contexts. So it typically shows up in young children. Often it is first identified in that sort of 2 to 4 year old range. And the reason it's usually picked up then is that is when kids are more likely to be then placed in settings and found in settings outside of one's own home, right? So typically these kiddos are actually quite chatty and quite talkative outside or inside of their home, but on the outside is where you see a really night and day difference. And you see often a total mutism, a total shutdown of the ability to speak. Some little fascinating details. It's 3 to 1 more likely in girls than boys, although I've definitely treated both boys and girls with selective mutism. The incidence of it, just to give a sense of sort of how prevalent it is somewhere between 1 in 140, 1 in 160. So while it is fairly uncommon, it's not unheard of, right? So that means in, a handful of classrooms, there might be one kiddo with selective mutism, right? So it is something that I come across actually with a decent frequency, although I'm sort of known for it. So I think families find me as well. But that is, I think, an overview that is important to hold in, that the capacity to speak is intact, but it is an anxiety-based disorder that is inhibiting the ability to speak in certain settings and context. And it has to be present for more than a month. So that's an important criteria. So it's not just one time kind of shutting down a verbal ability at target. It is a, persistent inability to talk in certain settings and contexts.
And now I know you mentioned that anxiety piece and being more of a stress response and a nervous system difference. Can you explain what that means in practical terms?
Yeah, so what that means is that the stressors in the environment, they can be sensory, they could be social, are so overwhelming that it inhibits an individual's ability to access language. So that might be hard to imagine because many of us are very verbally oriented, and it's hard to imagine not being able to access one's verbal language. But if you think about maybe a different setting where you're faced with a number of stressors simultaneously, maybe some real crisis moments happening, and you might find yourself losing the ability to, let's say, recall the PIN number on your debit card or do simple math, and you're just struggling to access these skills that otherwise you have very easy access to, but with the accumulation of stressors, you find yourself really struggling to do simple tasks that otherwise you're able to do. I think that's a good comparison for what it's like for a kiddo with selective mutism that experiences that accumulation of stressors that then shuts down their ability to talk. And these stressors aren't necessarily something that we would identify as trauma, but it could just be, a number of children. It could be a different setting. So often these are individuals that have an overall very highly sensitive profile, right? So we see that show up in that more narrow window of tolerance, which looks like things needing to be just right on a sensory level in order to be able to access that full range of skills, meaning talking.
It's so interesting. Now, do you see that families describe these children or their children not having any issues, and let's say they go to school and they have selective mutism come on, that they're very surprised that or do they have precursors, or do you see that they like, oh, now that kind of makes sense because they were this way or that way?
I'd say typically it's not a total surprise. They describe their children as being, yes, very talkative, very engaged and lively at home, but on the shy side, in public spaces. But what they are usually surprised about is how prolonged and persistent this shyness lasts. And I use quotes because this is obviously more than shyness, but that's the way it's often referred to by families, at least initially. Because again, this isn't something that most people have heard about before. So they might not be totally shocked by the fact that their child isn't speaking initially in class or answering teachers' questions or interacting much with peers. But then, once 4 weeks, 6 weeks, 8 weeks rolls around, then they start going, oh, this is a problem because we're not seeing a child that's just simply slow to warm. We're seeing a child that is unable to acclimate to this new setting and utilize their verbal language.
Yeah, that makes a lot of sense. And what I love about what you shared with me when we met earlier is that there's so much that can be done to support these individuals. And so I'm excited to share that today because I imagine for families it can be overwhelming and stressful or create a lot of uncertainty because it kind of can feel like this is a different experience when their child goes into this place of selective mutism. So I'm excited to share more about that. And I know we talked about how selective mutism can look different for each child. And can you talk a little bit about why some might speak to adults but not peers or vice versa?
So that is definitely true. There are some kids that will be unable to access language for both adults and peers outside of the home, but more often it is one or the other, that they really struggle to use verbal language with adults, so teachers, staff at school, things like that, or other students and peers. And the reason why one versus the other actually eludes me, but I will say what I do see is there's sort of a rigid set of rules that get sort of baked in, if you will. And once they're set, this idea of like, I don't talk to kids or I can't talk to kids, that tends to be sort of habitual at that point. And again, I want to be clear that isn't a conscious or intentional set of rules, but we all set up unintentional, unconscious rules to help us feel safe and protected in our environments, right? So we decide where we're going to sit in a theater because that feels more comfortable to our body. That's an example of an unconscious rule set that we kind of follow for our nervous system. So kids with selective mutism do the same. They establish an unconscious rule set for what is doable and what feels more safe. I also have some insights about this from older kids that I've had the privilege of working with over time, for whom selective mutism is largely resolved, and they can reflect on what their experience was like when they were unable to talk. And that's sort of the way they speak of it, is this idea of like, well, I couldn't talk to kids, but I could talk to adults. And they often can't tell me why, but they kind of allude to this idea of this unconscious rule set that gets set up and then, needs to be followed to feel safe in their nervous system.
I love that you bringing that back to the nervous system because I think that is so important when we're talking about this, and it's essential. And I imagine we'll talk more about that as we talk about strategies too. But being safe in your nervous system, how important that is for all of us.
Absolutely.
So, I love that you also have opportunities to talk to these clients and learn from them after the fact. That is fascinating. That's what a neat experience.
I'm know someone who is currently in high school, who I started with when they were just in preschool, and a very young child and unable to speak and fully participatory, fully verbal in school later, and including high school. So the cool thing is that it is very treatable. And so that's why I'm really excited to share some of those strategies today, because it can be very concerning, alarming, anxiety provoking, understandably, for parents, because how can one really access their education without the ability to communicate, right? So it is tremendously important. And yet it is fortunately something that is very amenable to strategies and treatment.
Yes, I love it. Okay, well, before we get into those kinds of strategies, let's talk about some common myths that we see about selective mutism.
So the most common one is if they want to speak badly enough, they will. So often folks try a strategy of withholding something really highly preferred and kind of having this standoff, if you will, on, you will speak and then you will get this thing. Always fails. It never works. And in fact, it backfires in the sense that the added pressure and urgency and intensity of that kind of high stakes interaction, whew, boy, it makes the language even harder to access, and so often is a real setback. And yet it's, a common initial intervention that folks do try. But if we think of it as a can't, not a won't, right? It doesn't matter if we promise them Disneyland or, the newest, best Xbox. It's not going to make a difference because they can't access that information and that ability at that time. Yeah. So that is, I think, one of the biggest myths is just this idea, if they want to enough, they will. Yeah. Some of the other myths are that it always is caused by trauma, or a traumatic event would cause this. While there can be an impact of trauma, it's actually less likely because of the situational nature. The fact that they are able to speak sometimes, but not other times in contexts, is less tied to trauma. When you see a trauma-based mutism, which is actually much more rare, it tends to be more across the board. And it also tends to resolve sort of more spontaneously over time, which we also do not see with selective mutism. That brings me to another myth, and that is they will grow out of it. Just give them time, or things like, well, boys develop language more slowly than girls. Things like that are often told to parents to just sort of wait and see. With selective mutism, really early intervention, and the earlier, the better. And that is because this sort of rule set gets more and more sort of baked in, more entrenched, the longer the selective mutism is left unresolved and untreated. So I don't want to sound hopeless, if your child is, in fourth or fifth grade and struggling with this, there definitely is support and they can resolve this. But I'll be frank, it's going to take longer and be a little bit more complex because of how long of a period of time they have existed with this rule set for their nervous system.
Yeah, that's such a good way to say it. And I want to go back to the trauma piece, because I didn't realize that you could kind of tease out the differences. Those are some significant differences, and that makes a lot of sense. And we had, I think I told you this when we talked earlier, we had a client once that we believe had selective mutism from trauma, and it was across the board. It was not in an isolated situation, and it did eventually work itself out as time went on with his situation. So it's interesting. That makes a lot of sense. The way that you're describing it is more, if it's trauma based, it is going to be more across the board versus, I'm curious to know kind of what happens in the brain. Not that we can answer it today, or maybe you can, but what happens in the brain to tip them over in these moments where they go from speaking in multiple environments to then not speaking in some environments. And, that is just fascinating to me how that works and what goes on to tip them over.
Yeah, it really speaks to the power of that nervous system. And when it is in that intense, distress state, how we lose function and we lose capacity. Now, obviously, the areas of the brain are intact and there, but the connectivity and the ability to access that full network, because all of these things we're talking about, language, for example, a vast network of brain anatomy implicated, right? It's not just one simple area. And so I think when we are faced with a high stress level in our nervous system, that connectivity and that networking is what really is impacted. And so the more complex skills, the more likely we are to lose that skill. Very basic things, right? Like, our physiological functions tend to remain intact longer, even in the face of high levels of stress. But things like our ability to do 3-digit division is probably going to be lost a little bit sooner, because it is a much more complex task. So I think that's one way to think about it.
Yes. Oh, yes. And as you were describing that, I could think of times where I couldn't access things that I normally could access in very high stressful situations. I know exactly what that feels like, and it is interesting how that happens, and that's a great way to tie it together and bring it to life. And so let's talk about some of the supports. So you use a coaching model with parents, and it makes so much sense the way you describe it. So let's just dive deep into that. What does that look like in your practice?
So I use a coaching model and I use a direct service model. So it's really cool in that both are effective and useful. But I want to be clear that I do both, and I would say the direct service is actually a hybrid where I'm also training parents as well. Because my goal with direct service is that I become a talking bridge, right? A communication bridge. And then I am helping to support the child in establishing talking relationships with other relevant adults, right? Because while it's great if a kiddo talks to me, it's actually much more important that they're talking to their preschool teacher, right? And so we don't stop with just, yay, they're, talking with me. We keep moving forward. Simultaneously, I'm training the parents to also serve as that communication bridge. Okay. And then with families that maybe are remote and not in the area where I can work with in a direct service model, it does work to do pure coaching where I am training parents on how to be that talking bridge and then using that skill set to establish new talking partners, with relevant adults in their child's life, or children if it's a child that is struggling to talk to other peers. So I just want to kind of give that larger frame of how that works, and to establish myself as a communication bridge. It's the same process that I train parents to, let's say, use themselves as a talking bridge for establishing communication with, let's say, the preschool teacher. And what you do is a process called fade in. And you are using a process to fade some new communication partner into verbal interactions. So one of the things that I first assess for is what is a really preferred high value activity that a child is going to be really gung ho to engage in, right? We want it to be super fun, super interesting. And that sounds really basic, but I don't want to skip that step because it's really important. Once we're, selected that activity, what I coach the parent to do is to engage with that activity as they usually would. And then what they're looking for are 4 signs of readiness in which to then try to elicit some verbal communication with that new talking partner, whether that be the preschool teacher or me, right? If we're in an in-person model. And those 4 signs of readiness are, we look for a kiddo handing an item to the new person, let's say me or the preschool teacher, right? So I might verbally elicit like, oh, when you're done with that purple marker, may I have it? And I'm not expecting a verbal response. This is just more of a verbal cueing. And then with a gesture, holding my hand out. I also look for a child taking an item from me. Oh, here you go. And I hand it over, right? And will the child take an item from me? And this is important because gesture and physical back and forth is a proxy for verbal communication, right? So can we make that type of exchange and connection, which is, for most kids with selective mutism, easier to access than that verbal piece. So we start there, right? We want to build capacity and function. I'll mention that alongside this activity, this preferred activity, I suggest that the teacher or, myself, if I'm the person being faded in, use a very little other language, specifically language that is prompting a verbal response. So things like saying, ooh, wow, tall tower. Great, right? But, oh, what's that tower? Is that the Eiffel Tower? Maybe not, right? Because that is adding some pressure to the interaction by asking a question. Now, I'll be honest, it is really hard for adults to suppress the question asking. We tend to pepper kids with a lot of questions. I became crucially aware of this when I first started working with kiddos with selective mutism and was integrating this guidance around stop asking questions. I was like, oops. But it is okay to, comment and narrate. And those types of verbal interactions are okay. But we want to really try to not add added pressure with questions. The third thing we look for is the green zone. So the green zone from the neurorelational framework is the term we use for that just right regulated state. So often we can perceive it and see it in sort of maybe bright, shiny eyes. We've got sort of a body posture and movement that has a nice rhythm and flow to it. We don't see a really stiff, immobile body or a really slumped body, right? There's sort of that just right body posture. And we see a child kind of freely engaging in their preferred activity, right? So we want to look for handing materials, taking materials, green zone. And then the fourth sign of readiness is if I sort of turn away from the activity. Let's say we're in my office. There's a closet in the corner that has lots of different, art activities. And I say, oh, hold on, I'm going to go grab some new markers. These ones are a little dried out. I turn around and I go to the corner and I open up the closet and I have already prepped the parent that they are going to ask their child a question while I am a distance away. And so they might ask their child, something about, oh, did you finish your snack today or do you want some more? Or would you like when we're done to go get some boba or would you want to go straight home, right? Something that you feel the child is likely to want to answer because they might be invested in it and something that's pretty easy. And what I am noticing is if, I can audibly hear the child answer the parent in my presence. That's a really crucial step. If they are not answering their parent, then we kind of just repeat, signs of readiness 1 through 3 until we get to that fourth step and they're able to answer their parent. There's little workarounds if we get a little bit stuck. Sometimes I'll even leave my office and say, oh, I want to refill my water bottle. Let's see if we can establish verbal language just in a different setting, right? Mm-hmm. Not with me present. So there's little workarounds and little kind of a decision tree algorithm, if you will, on what to do. But once those 4 signs of readiness are observed, I have coached the parent to use a fade-in question in which they are prompting the child to answer something, but they are totally guiding the whole thing. So again, I'm using them as the bridge, right? They are bridging, because the child talks to them, bridging to speak to me. So they might say to their child, oh, go ahead and tell Miss Jessica what you're going to be for Halloween. Something that's exciting, something that is easy. Again, we're not quizzing them on anything. They know the answer to this. And that is that fade-in question. And if the 4 signs of readiness have been observed, I find that 90% of the time, they will answer that question. There might be 15 seconds of silence first. There might be a very low volume, and maybe even kind of turned away posture. That doesn't matter. The volume doesn't matter. It's just the utterance itself is all that we're focusing on. And so from there, the parent can use follow-up, questions like that. Oh, and go ahead and tell her what did we carve our pumpkin, this year for Halloween? Or go ahead and tell her what candy did we get to pass out for Halloween? And what is interesting about that question is the parent is also giving permission. Go ahead and tell. And that often is a helpful cue for the nervous system that this is safe. So I just peppered a lot at you. I'm going to pause to see what questions there might be, but it kind of has a sequence to it. So I wanted to share all of it together.
Yes. it is a package deal.
Yeah,
And
yeah.
I love that. And I love that it's so structured, that you have a clear vision and plan. It's very teachable to
Hmm.
parents,
Hmm.
for parents to digest.
Hmm.
And it also, what stood out to me is that it really is about staying in the moment, making adjustments to the child, helping the child feel safe and comfortable, so they can really have a supportive nervous system,
Hmm.
and with a high level of engagement. And I think that is so, all of those things I feel like can apply to our kids with autism. They could apply to even the PDA population,
Hmm.
just all of these types of strategies. I mean, they have a similar thread of a nervous system challenge of anxiety
Right.
and some high level of uncertainty. So it makes a lot of sense. The other piece too is that declarative communication is so huge. And
Hmm.
as you mentioned, it can be challenging if you're not used to using it
Hmm.
that much, but it's such a powerful thing.
Right.
And it's something we use a lot in our work with, as RDI consultants, and it's just so valuable for kids with autism as well. So I love that that is just kind of your flow, and I can see how it can be super effective and powerful, really powerful.
Absolutely. Yeah. Yeah. And there are threads of interventions that are supportive for other diagnostic categories as well. And I'll go ahead and mention that there's a fair amount of comorbidity with selective mutism and autism. And it makes sense because both of them are nervous system differences and nervous system based challenges. And so it is often the case that the autism is uncovered after the selective mutism. Because at first it's like that's all anyone sees is, oh my goodness, this kid isn't talking. But once
Right.
they have more verbal language, it's often apparent that the nervous system difference is a little bit more pervasive than just a challenge around accessing language. Not all the time, but I will say it's more frequent.
Yeah, that makes a lot of sense because we're looking at the nervous system,
Mhm.
and when you go down to that level, it
Mhm.
really does make a lot of sense. And now I know when we talked, you mentioned this ladder idea of communication
Mhm.
partners. So what is this ladder concept, and why is it so helpful to identify when you're working with these clients?
So it's helpful because it allows us to create a hierarchy of more less challenging and then more challenging individuals to establish a talking relationship with. So once the verbal language is established with me, then my job is to become that talking bridge for other individuals, right? Or in the case of a coaching model, the parent is going to select an individual to start with and do that fade in process I just outlined with one individual, and then you move on to the next one and the next one and the next one. You want to pick initially someone that you believe will have a higher likelihood of generating that verbal connection. So for many families, they identify people that are warm and have like kind of a positive energy, but not too intense, right? As being people that their children are more likely to talk to or feel at least they see their body and posture being more comfortable around that individual, right? And so
Yeah.
you want to pick someone that maybe embodies some of the characteristics that your child tends to feel more comfortable around or whom your child has shown an interest. So maybe your child doesn't speak to this child or this adult, but they talk about them at home. And that is actually fairly common that kiddos will identify people they really like or are interested in. They might even say, "Oh, so and so's my friend." And you might think, "How is that the case? You're not talking to them." But they have a high level of interest in certain people, and we want to start with those people that they have that intrinsic motivation for. Then there's individuals on the other end of the spectrum that are much going to be much more challenging to establish that verbal language with. Maybe they have sort of a more intense, more abrupt sort of style. Maybe they're kind of barky and direct in a way that you see your child's nervous system respond to, right? Maybe they do a lot of kind of combo zone to use that neurorelational framework stress response of anxiety that accompanies anxiety and panic. And that's going to be a much more challenging individual. It also has to do with someone who's interested in doing this process with you and your kiddo, right? So someone who is open to taking this, going on this journey with you and your child and titrating their language, using declarative language, learning about, what's helpful and what's not helpful. Those are individuals that are great to start with. I will say it's easier to do all of this with another adult. We can often guide them in more explicit ways when we're talking about establishing verbal language with other kids. It's sometimes more challenging because we have less control over what they are going to do.
Yeah. Do you see that parents typically choose a family member, like an aunt or a cousin or grandparent or something like that, to play this initial role?
So often kids do talk to family members outside of their immediate family if they have frequent enough contact with. And so that is an initial step, is sort of doing what I call a talking map and figuring out who they're talking to, where they're talking, sort of what is the specific rule set that is in place. Maybe they talk to grandma, but they only talk to grandma at their house, but not at grandma's house, for example. So then maybe we would want to first start with, talking to grandma at grandma's house, for example. Yeah. So sometimes it's a family member, but often there's a real urgency around establishing the verbal communication with, someone in an education setting. So at times, even school districts reach out to me and contract with me to provide support because it's such an urgent issue when children are unable to access their education due to this challenge.
Oh, that's fantastic. That makes a lot of sense. And so in those cases with school districts, are you going into the school then and kind of bridging yourself with the child to the teacher?
Yes, at times that is the case. At times I am coaching the parent to do that work. It just depends on how close the school is to me, proximity wise, and schedule constraints and such. But either does work, and I think that's a really so useful because there are relatively few providers that are well versed in this protocol. And so, it would be just so tragic if you had to live only in, the LA area in order to get support in this area.
Right. But that's what I love about it.
Yeah, a coachable model. It really extends the reach.
This show is brought to you by Therapeutic Approach to Growth. Therapeutic Approach to Growth helps families with relationship and behavioral needs. Their holistic programs are individualized to honor and respect each family and their autistic son or daughter's sense of self through programs such as relationship development intervention, naturalistic ABA, and animal-assisted services. If you're finding yourself frustrated or discouraged with your current behavioral programs and would like to see more long-term meaningful growth for you and your family, then contact TAG today at www.tagforgrowth, that's TAGFORGROWTH.com, to learn more about how to schedule a consultation or how they can offer you the help your family needs, whether in person, remotely, or in a school setting. Again, that's www.tagforgrowth.com.
Yeah, that's huge. I was curious as you were sharing, do you ever talk to the children or your clients about their diagnosis? Is this a formal diagnosis that they're given? And then do you share with them what does that conversation look like? Or are you just supporting them in more of this 4-step model?
So it is a formal diagnosis. It is something, with criteria in the DSM. So it is reimbursable and all of that from insurance purposes. I often do not share it with children because the more attention sort of explicitly paid to this fact that talking is hard, it often has a counterproductive impact. Now, once they have established a verbal relationship with me, then sometimes I will make it a little bit more of a conscious topic and talk about how we're going to practice more talking with more people. But I keep it pretty chill like that. I don't get into, diagnostic labels. There are a few books that are out there. One is called Maya's Voice. That's a children's book that sort of introduces the idea of selective mutism and more importantly shows that a child can overcome it and speak in social settings. And so with some kids that is helpful, but I don't universally endorse like reading all those books to your kids at the beginning, especially because it can just sort of unintentionally pile on more pressure and more attention to the fact that talking is very difficult.
Yeah, that makes a lot of sense. And yeah, I'm glad that I asked that question because it is such a unique diagnosis and important to really address it individually, and based on the need. And different than sometimes it's interesting for me being in the field of autism mostly because it is a whole nother conversation around talking about autism. And there's many different camps in the field, sharing it with your child or not, and parent choice, of course. So that makes a lot of sense in this case, why it's a careful process, as you mentioned. And before we go on to more sensory processing, so I want to make sure we touch on that as it relates to selective mutism. Let's talk about the fading out process. What does fading out during a parent session look like, and why does that work?
So, as I outlined, the verbal interaction established between me and the child is highly dependent on the parent. And yet, we want that to become a more independent verbal relationship. So, initially, it is entirely dependent on them. And the fade out process is fading out that dependency on the parent. So, what it will look like is maybe after a session or two where they are readily responding verbally with the parent's prompts, I might spontaneously sort of engage verbally and see if they will, respond to me without that parent prompt. And once that happens, then again, I've coached the parent to be like, oh, I'll be right back. I need to go to the restroom. They kind of go quietly excuse themselves and leave for a few moments. And then I see if we can maintain that verbal relationship even with the parent not present, right? And so I'll continue. And if we've sort of followed the steps and we haven't rushed anything and the nervous system is truly feeling safe because we've done all that great foundation work of safety, they will continue engaging verbally with me, even with the parent gone. And then we extend that time, right? So parent might start the session with me, but then say, in about 15 minutes, I'm going to need to do some work emails. I'll be out in the waiting room and, look forward to hearing what you and Jessica finish up in the rest of your time together, right? So they are going to be gone for more and more time. And that is what we do with fading out. It's the same thing for, if I am working directly fading in a teacher, then I fade myself out of their interaction over time as well. And one thing that I'll mention for the fade in and fade out process, once you've sort of established that verbal connection, it's great to use some verbal based games to just keep it going and keep it going in a really easy way. So things like go fish, right? You need to speak. Do you have any, fours? Do you have any sevens? There's no way to really play the game without using verbal language. Or the game Spot It also requires verbal language. The game Kitten Caboodle. It's out of print, so it's kind of hard to find, but it's a really good one for engaging and requiring a verbal reaction and interaction. Guess Who, right? So all of these games require you to kind of ask questions and use language. And so that's a really nice easy way to keep verbal interaction going without peppering the child, with questions, right? Which is not advisable. Some kiddos, again, because this is an anxiety disorder, just answering questions can be hard, especially choosing things can be hard. And so something like a game where there's not a lot of choice to be made, we're just following the rules and flow of the game sometimes is much easier. I'll mention if you are using questions, forced choice questions are better than yes, no questions or open-ended questions. So yes, no questions, the problem with them is you can just go like this, right? You can nod instead of requiring a verbal response. And open-ended questions can just be really challenging, right? Again, for especially a child that also is, feeling anxious at times in these social interactions. So something like, ooh, which ice cream do you prefer, vanilla or chocolate? Is better than what's your favorite ice cream flavor? Oh boy,
Right.
that's a hard question for me to answer.
Yes.
There's a lot of choices. So, but things that are framed in a forced choice are often easier for that child to access.
Yes, I see that with my clients as well. And sometimes we need to bring that in as a support to get the participation going,
Absolutely.
really work. Okay, so why don't we talk about sensory and how does sensory processing and regulation play a role in selective mutism?
So, as I described, these kiddos are often highly sensitive, just overall. And so that would then include their sensory system and then, have a impact on their regulation overall, being that highly sensitive profile. So what I find is that, kiddos with selective mutism often are auditorily kind of hypersensitive. So a lot of sound is going to be more likely to, cause more of a kind of a shutdown response or an overwhelmed response. And again, then shut down that access to verbal language, right? They often have more sensitivity just around kind of chaotic spaces, really, high intensity spaces. So, if you think about high intensity chaos and a lot of sound, I'm describing the average preschool classroom. And that is not a criticism. That is actually what makes them sort of joyful places if your nervous system likes that, right? But for these kiddos, that often is an aversive experience. And so they tend to do better in smaller settings and more kind of low key settings. They tend to do better with, smaller groupings of children and one-on-one or two-on-one sort of interactions because it's less overwhelming and distressing on their sensory system. So, one thing I'll note is that if you are using some of these selective mutism strategies and not feeling like things are really moving forward, it might be worthwhile to get further assessment in that sensory area to find out what specific triggers might be sort of sabotaging your efforts at moving forward with establishing verbal language. Some kiddos also respond very positively to certain sensory inputs. So I have a swing in my office, and there are some kiddos that are mute, 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 mute. They get in the swing and spontaneously are like, woo! Now that's not language, but it's a sound. So it is a bridge to help make that verbal communication easier. So often vestibular input, that movement input in the body can be helpful in supporting that regulation and that green zone and allowing language to then unfold.
Yeah, that makes a lot of sense. And I think that's an important component as we're looking at the nervous system, and I imagine some of these individuals, these clients that you work with benefit from a sensory-based OT as well, as you mentioned, getting that diagnosis so they can have that additional support if needed for that area. And now I want to talk about this window of tolerance. This is another term you used. And what does this mean in this context? And how can parents or professionals learn to identify it?
So the window of tolerance has to do with the specific sort of just right criteria, if you will, that the child's nervous system needs in order to access verbal language. Now, initially, a child with selective mutism has a very, very, very narrow window of tolerance, meaning maybe it's just, a parent just at home, maybe just siblings, right? A very narrow set of criteria that they're able to use their language. And the goal is to expand that window of tolerance. And the sensory input is really important, and those sensory considerations. I'll give an example of a child whose window of tolerance was expanded through the use of sensory input. So this child did really crave that vestibular input in their body, that movement. And I don't know if you're familiar with those inflatable, I think it's called a roadie. It's sort of a bouncy little, it's sort of like a yoga ball, but it's molded like a little horse. So a child can sit on it and ride it, if you will. So a kiddo that really enjoyed that kind of input. And what I found was my office is down sort of a long hallway. But if I would leave the roadie at the start of the hallway and the child would ride the roadie in, bounce, 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 bounce. I don't know, maybe it's 50 feet. By the time they would get to my office, they were in a state that allowed them to access their verbal language. And I didn't have to do any of the other sort of warm up, fade in questions and strategies. That simply giving their body that input that it needed helped them unlock their verbal language. They would kind of be laughing and, making utterances verbally as they're on the roadie. And then by the time they were in my office, they would, be chattering with me. And so that was really cool in a way that we can utilize sensory strategies to expand that window of tolerance.
Oh, I love that. Wow, you just brought up so many fun memories back of the roadie days in my house. My girls loved those. And those are a lot of fun. And that's such a great, authentic and meaningful sensory opportunity, and doesn't feel like work. It's just fun, but supporting that child in that way. So that's fantastic. Okay, well, let's talk about professionals. We've talked a lot about parents and the supports and the role they can play, but do you have specific suggestions for professionals who might have a child with selective mutism in their classroom?
Yeah, so for teachers and educators, I think that you want to partner with the parents and start being curious with them about what might be going on. I definitely encourage you to be proactive in talking about it, because it isn't the sort of thing that's just going to go away on its own, that it almost always needs, really specific support. So that is, I think the number one thing for people in an educational setting is to really partner with parents. It's tricky because in that professional role, you can't, mandate treatment or support, but you can be curious and supportive and wonder together, like, if there's support that would be helpful, or other professionals with that expertise that could be brought in to support the child. For mental health professionals, because sometimes these kiddos land, in therapist's office or speech therapist's office, I think I want to encourage people in that position to seek out additional training and support. The way I work with kiddos with selective mutism is like nothing else in my practice. It is very specific, and it is one of the areas that just general good play therapy is not likely to move the needle, right? Or good general speech therapy or good general any kind of modality is not likely to really change and impact this capacity to speak. It is a very specific protocol that fortunately has a high level of success and pretty quickly. These are kiddos that I tend to work with for only a number of months, that it really resolves rather quickly, and they might continue to need some support, but because of the parent coaching component, as challenges come up, the parents are able to kind of manage that on their own. So it is, highly successful with that right intervention protocol.
Yeah, and it does make sense why the kind of flow that you're going through is so supportive to their nervous system. And I love the part that the parents are empowered, that they then can help others, help their children as needed. And I just think that is such a gift you're giving them. And, as coming in with that guiding support and then transferring that over to the parent, it's a beautiful thing you're doing. And, I'm grateful that you were able to share all of these strategies and resources today. And I know you mentioned a children's book, but do you have other books or programs, or if a parent or a professional wanted to get training in this, what would they do and where would they access information? And I will include all of your recommendations in our show notes as well, but I'd love for you to share any resources that would be helpful.
Sure. Well, I think the selectivemutism.org is a great place to start. It has a lot of great information that you can share with teachers and other caregivers. So I think that is a great place to start out on this journey. There's lots of book suggestions on that website as well. I think in terms of other suggestions, I have often intensive camp programs are really helpful. I don't necessarily have an endorsement of a specific one, but that intense model can be really helpful if you don't have access to a provider, nearby, that doing something, let's say over the summer for a week or two. They all incorporate, or they should at least, I guess I would look for this, a parent training component, so that you are also getting that empowering information to help generalize and grow that progress across other domains, once you're done with the camp. But also that intensive experience for your child as well really builds momentum and confidence, definitely put high on the list.
Fantastic. Great. And I want to have you have a chance to leave us with one final thought before we share how people can find you. If there's one final thing you would share with our audience, with families that are just starting out on this journey, that are feeling that uncertainty and angst, what would you share to them?
I would share that this is a condition that is so treatable and so remedied through specific supports and specific strategies, that while it can be really alarming, I want you to really be hopeful and think about, in 6 months from now, it is entirely possible that your child is talking in preschool. And that in a year, you'll look back in your rearview mirror and go, oh my gosh, remember when my kiddo wasn't able to talk in school? It can be that fast. It can be that quick. And so I want you to know that is absolutely realistic with the right supports in place. And it's hard to imagine maybe where you're sitting right now, but it is absolutely the case. And so I think there's a lot of reason to be very hopeful, even though you find yourself in a relatively uncertain place right now.
Mm-hmm. Wonderful. Well, thank you so much for sharing that and all of this information. It was so enlightening, and I learned so much just hearing you speak about it, and just value everything you're doing for the community. And I want to make sure you have a chance to share how people can find you.
So people can find me on Instagram at JessicaRichardsLCSW.com. They can also find me online at my website, JessicaRichardsLCSW.com. I do periodically run remote parent coaching, 6-week classes on selective mutism, so really guiding families in a small group. It's limited to 8 families only in implementing these strategies, complete with homework. So we try things out, we come back, I help you problem solve and strategize. So I do offer those about twice a year. So if that is something that sounds useful to people or you're interested, I encourage you to reach out to me, send me an email, and I will get you on that list for the next offering of those remote classes.
Wonderful. Okay, well, I will make sure to include your contact information in our notes. And thank you so much, Jessica, for being here today and sharing this information. I really appreciate it.
Thank you so much for the opportunity.
I'm dancing on the edge again. The wind is calling my name. I'm dancing on the edge again. This time I'm not looking back. You can change
The information provided on this podcast is for general informational purposes only. The content shared is based on the experiences, opinions, and perspectives of the hosts and their guests and should not be construed as medical advice, diagnosis, or treatment recommendations. The discussions and topics covered are intended to foster understanding and awareness of autism therapies, but are not a substitute for professional medical guidance. Before making any decisions regarding therapies or treatments, we strongly encourage you to consult with a qualified healthcare provider who can provide personalized recommendations based on your unique circumstances. By listening to this podcast, you acknowledge and agree that the hosts, guests, and producers are not responsible for any consequences, damages, or outcomes arising from the use or application of any information during the show.